A 54-year-old Nigerian male has undergone a cerebral aneurysm procedure at the First Cardiology Consultant Hospital here in Lagos. It is the first of its kind to be done in this part of the region and designated a minimal invasive case. Correspondent Ninalowo has more.
Cerebral aneurysm coiling is when a metal coil is inserted into the aneurysm through arteries that run from the groin to the brain. The coils remains there and not removed to stop blood flow and reduce risk of a bleed or rebleed. It is a first of its kind procedure in this part of the world.
So we're going to do something called endovascular cerebral aneurysm coiling. So basically when blood vessels in the brain basically form sacs that could bleed in patients. That's basically called a cerebral aneurysm. And traditionally, especially in Nigeria, the only way to treat that is surgery, which means you crack the skull open and you go put a clip in there. All over the world now, the new treatment for this is basically endovascular, where you go through a small artery in the groin, you go put a catheter in the aneurysm in the brain, and you put coils in there, and basically the patient has no cut in the brain, no cut on the skull. The patient could recover much faster. This skill has not been available in Nigeria for years. Basically, it's never been available in Nigeria. What I do is body interventional radiology, basically, where I treat mostly things from the neck to the toes. I was not really trained in the past in doing brain work. We did our first cerebral aneurysm, interestingly, in Nigeria with one of my partners in London about 3 years ago. But we've been kind of frustrated with the efforts of getting that program going, especially with the COVID pandemic, and that basically stopped that.
Medical experts also explained that the coil is inserted via catheter to fill a brain aneurysm, that is, a bulge in a blood vessel. The device can stop a ruptured aneurysm from continuing to bleed.
I'm an interventional radiologist, but for many years I focused more on the treatments of head problems, brain vascular diseases. So my role here as an expert of treating aneurysm and any other kind of neurovascular disease is help Dr. Hamed to treat this aneurysm. And also by time to rule out, to make this program grow, as Dr. Hamed said, I think we need to assist and train progressively the people here to get these patients treated here.
What we're doing today here, partnering, is to bring our neurocritical expertise to patients requiring aneurysmal coiling, which is the first one being done in this country. So a group of doctors who have been pulled together to do this so that our Nigerian patients can also benefit from this. So we're providing neurocritical support for these patients after the coiling, within the coiling process, so that their outcome is improved.
There are long-term benefits for cerebral aneurysm coiling procedure to be performed in Nigeria.
So I think we have to do these things for a while, and also an important thing to make this sustainable in terms of learning curve is, as the more cases are done here, it will be better for everyone. I mean, firstly for patients, and the doctors will be trained much easier, and also for a skilled interventional doctor dealing with catheters in all the body. With some help, he will be able to get great also in the brain.
Interestingly, this is actually not our first case. We did our first case about 3 years ago with Dr Kunle Ogungbemi from the King's College in England, where he came to Nigeria and proctored me to do a cerebral aneurysm coiling. And we plan to move on with that program. However, the COVID pandemic really just killed our efforts. So we've now revived that program over the last 2 years. Now we have a consortium with myself in interventional radiology. We have 2 neurointerventional radiologists in our team now, Dr Kunle Ogungbemi in London and Dr Roger Barrano, pons, who comes from Dubai.
An aneurysm is a bulge in a blood vessel caused by a weakness in the blood vessel wall, usually where it branches. As blood passes through the weakened blood vessel, the blood pressure causes a small area to bulge outwards like a balloon. Ninalowo, Rise News.
Antibiotics